My whole life, I've been up and down with my weight. I was thinner in high school, and then after I got married and had children, I started gaining weight gradually until I was about 293. I did go over 300 at one point, but then I came down. As a young adult, I think I really went to food for my comfort and worked through some of those issues that I had with food. But then food was if I was happy or if I was sad or if I was celebrating something, let's go out to eat. And food became really the focus of my life. And I enjoyed my life. I was very blessed in many ways, but I always gained weight. I did a lot of different weight loss programs. I would lose maybe 30, 40 pounds, and then I would gain a little, couldn't sustain that weight loss. And then I would get frustrated, and then I would gain a little bit more. So I think some of the daily struggles was I didn't have any energy. I was on all these different medications. As a nurse, I worked 12-hour shifts. I'm a pediatric nurse, and I just couldn't keep up with that. Now, I was also a nurse educator, but then I had to give up my floor nursing just because I was exhausted all the time. I just couldn't keep up. I just felt like I didn't have the energy. Around 2020 in the fall, I was diagnosed type 2 diabetic. And at that time, I just thought to myself, this is enough. I teach my patients how to live healthy, how to live healthy lifestyles, and yet I was not living a healthy lifestyle. I also, as a believer in Christ, my body needed to honor the creation that God had made me. I've thought about gastric bypass in the past, but I always felt that was too extreme. But I think my body had gotten so used to the amount of weight that I had that it really wouldn't shed more than 30 to 40 pounds, even on the strictest diets. I guess I always thought it made me look weaker, but realizing that I have had this weight problem for such a long time, it wasn't going to be like the easy fix. I thought, this is the easy fix. No, it was going to be a lot of hard work. I did a little research myself as a nurse educator. I sort of pulled up some articles and did a little research myself. And I thought, my body is just sort of stuck. Like, I could lose weight, but maybe at my age and my metabolism, I just would lose 30 to 40 pounds and that would be it. And I thought I needed to do something a little more comprehensive. And so I reinvestigated bariatric surgery. And that's why I, looked at it. And I thought about it and prayed about it for about 6 months before I even went to Dr. Joyce's informational meeting. Before surgery, food was just, it really wasn't something that was for nutrition. It was for comfort. And it was for what I was doing at the time. This surgery has really helped me learn how to make better choices. I don't think of it as depriving myself anymore. I think of it as making good choices for a healthier body. So the recovery, of course, at first it was hard because you have special diet but so I had about 6 months to prepare for that surgery. So I knew exactly what was going to happen and how it was going to feel. Like I said, sometimes I would go to food for comfort. So at this point, I can't do that because it didn't comfort me at all. It just made me sick. But that was a good thing because it really taught me then to really face whatever it was that I was trying to be comforted from, and to go to prayer or to face the issue, relearning and appreciate what food really is, and that's nourishment for our bodies. I lost, in the first 9 months, I lost about 100 pounds. And after 7 months, I was off my diabetic medication. And I've been getting my blood sugars checked like every time I go in for my physical, and that's gone. So altogether, I've lost about 150 pounds. And right now, I'm just maintaining. I was on a lot of different medications. I was on metformin, 2 different blood pressure pills, Lipitor for high cholesterol, and I'm actually off all of my medicine except for about 1/4 of a dose of the blood pressure. I am diabetes free. So I have my A1C, which is a blood test that they take, has been within normal for the last year and a half. I think if you're considering gastric bypass surgery, I definitely would recommend going to BMI because they were wonderful. So I wish I would have done it sooner. I turned 60 this year. I had it done when I was 58. So those would be my two advice. If you are thinking about having the surgery, don't put it off. Go to the information meeting, get as much information as you can, and they are very supportive. BMI was amazing. So if you're heading into surgery, I definitely would recommend, following what the doctor tells you to do. Be patient with yourself. If at some point you're like, oh, I went out to dinner, for example, and I ate more than I should have, but then I got really sick to my stomach, it's okay. Just the next meal, eat what you're supposed to eat, do what you're supposed to do, and I believe that the weight loss will come off. You will feel so much better when you follow what they say, and you'll be able to do so much more.